this region, and this undersurface tears needs to be fixed. And in this particular case, we are using a new device, which is a EcoStitch device. The device is inserted through the lateral portal here in this direction. Okay, so this is a inside out technique of a all inside repair. So again, this is a newer concept, and I would ask my assistant now to put a needle. So needle here is just put the needle, please. So the needle here is just a passing needle. So you go it nicely. So the needle here is the passing needle. We don't want to tie the needle. We'll not be opening it. And the needle is just used to pass the anchors onto its place. So you can see now that this first anchor is passed. So now if you see here, the anchor is, the first needle is passed into its place. So once the first anchor is passed into its place, the first needle, the wire is removed from here. Okay, this is the first needle wire, we have removed it, and then we will be inserting my second needle, which will be going, if you can see here. Okay, so this is my second needle, and the needle is going into the inferior surface right there. Okay, this is my second needle. Okay, take it out. Take it out. Remove. So this needle comes out from here. I will pull this anchor out in this region. Okay, and now you can see that we have two needles which have gone into their place, and we will be pulling the needles sequentially. One needle has a green suture and the one needle has a blue suture. So now this is the green needle, and then there is, you can see, and now you can appreciate that we have an anchor. This is an all suture anchor which is there for deployment, and you need to pull the green one. So once you pull the green suture, stop. Just pull the green one. Just a minute. So this anchor is deployed now, green suture. That's it. So now you can see that the first anchor is deployed into the position, and look, now we will be using the second anchor. Pull it, please. You can see the second anchor coming into the picture. Relax. And I am holding my artery here so that it does not pull it further. And then I'll ask my assistant to pull it further. Very good. Just 1 millimeter more. So that's it. So that's my second, and then I will take out my cannula. And now you will appreciate that both of my anchors have gone in. Now this is a self-tied loop which is there, and if you can appreciate these two threads, we will be looping these threads one by one, and once we loop these threads one by one into its place, the meniscus will be repaired into its place very nicely. You can see that the meniscus portion which was everted initially goes back into its place. Pro please. And then you achieve a very secure repair here. Okay, and you can tension it well, and then I would need just a suture. Can you hold it, please? So you can see that the meniscus repair is nicely done. The loop is there. It has cinched very nicely. It is locked very nicely into its place. Now what I can do is I can just leave it here, or I can make a suture, a security suture again here, and we can just cut it after that. So you can use a shoulder instrumentation set to actually take these needles out and cut it. Okay, so just a minute. So this is the internal aspect. So you can see that the repair is very good. Both the knots are into its place, and the meniscus is everted out. So this is a very nice repair that we have achieved. Okay, now coming from the outside. So these needles are just the passing needles. You don't need to make an incision here. Once you are done with that, you just need to cut this thread and take this needle out. So there will be no incision on the posterior medial aspect that you see in the inside out technique. The advantage of this technique is the size of the puncture is the smallest. So the pull out strength of these sutures is very good. Cannula, knot pusher and shoulder instrumentation. So you can see that now the meniscus repair is done. Pro please. So the meniscus repair is done and we can see that it is very nicely reduced into its place. And this is what we call as a hybrid repair. It is a mixture of inside out and all inside technique. So basically it is all inside technique, no incision on the posterior medial aspect, and a very good fixation because you have a very small puncture of the meniscus per se. And this you can just cut it now, or you can tie one security knot and then cut it. Knife please, cannula please. So what I'll do is I'll try to make a safety knot here just to be more sure, and then I take it out and then I'll just close it up. So I'll just use my cannula here in this place. Green retriever please, hold this. I'll take both of my threads from this. It comes with a self-tied knot, but what you can do is you can put an extra knot also to secure it. So you can just finish it at this place and you can just cut it, that is also fine. If it is not good, what you can do is you can just put a safety knot here apart from your standard knot which comes with the system and tie it back into its position. So it closes very nicely on its place. Okay, so this closes and this makes a very nice repair per se of the meniscus. You can see that the everted meniscus is gone, the meniscus is actually inverted, and then we can just tie it back into its place. Pro please. And then when we go in, you can see that there is a very nice solid repair of the inferior